Next.
C, approval of the October 25th, 2022 meeting minutes.
For approval?
Moved and supported, Marecki and Dobb. All in favor of approving the previous minutes, please say aye. Aye. Opposed? Okay. Where's my off the agenda? Okay, we will need to adopt the agenda, and we do have a couple of small changes to the agenda today. Item number 5, a presentation with NAFCARE. That is going to be moved to our next full meeting. And I'm also going to want to, we do have an addenda today with item 6, and I would like to move that to the first item of business and then just do the agenda from there, and also taking out the presentation from NAFCARE. So that will be the agenda. Do I have a motion to approve the amended agenda?
So moved.
I'm sorry. I got a lawyer over there going. All right, Counselor.
Through the chairs, within your discretion as acting chair to modify. So you're just going to move the items around. That's fine.
Fine.
That's fine.
All right. No, you don't get to make a motion. So we'll just move on. So Madam Clerk, first item is actually item 6 from the addenda.
Item 6 on the addenda, requesting commission approval of the appointment of Karima Bentunsi to the Detroit Wayne Integrated Health Network Board.
Alrighty, thank you very much on that. So there is a state law out there that lays out the procedure for appointing to a mental health authority. I'm going to ask the Commission Council, does this proposed appointments conform to everything in the state law, the requirements in the state law?
Through the chair to this honorable body, you are correct. There are several requirements and qualifications for members to the DWIN board. Based on the information provided by the administration, is our understanding that this individual qualifies and meets the necessary requirements for appointment to the board.
All right. Mr. Fakuri, for administration, who's putting this nomination forward, would you like to make some comments?
Through the chair, thank you. Yes, on behalf of administration, I want to thank commission staff for their time and energy in accommodating the rescheduling of getting this on the agenda. So thank you. And due to the rescheduling, I'm just passing on a deep apology from Ms. Bentunsi that she was unable to accommodate today, but will be at full board for sure. So thank you.
Thank you. You want to say anything about the nominee as long as you're there?
Well, I will say that this nominee came by way of some true vetting in the community, making sure that the representation and compilation of the board of DWIN was accommodated. But what was really something that stood out was her will and motivation and passion to want to serve in this capacity. Beyond that, I think her resume and her credentials that were shared really speaks volumes. And so we're excited and we are grateful for this honorable body to accept our recommendation for the proposed candidate. Thank you.
And thank you, Mr. Fakuri, for trying to get her here today. Been around the commission a while, you know, sometimes with the nominees, we don't get them in committee. We only get them at full board, but the effort was made here today. And with election day, when we're usually scheduled for this meeting, and moving it to Thursday, just a difficult time administration had and unsuccessful in having her get here today with her busy schedule. So we do have a nominee properly before us. Questions, comments from commissioners on this item? about a motion then? Commissioner Marecki moves, Commissioner Dobbs supports. All in favor of moving this nominee forward to full board, please say aye.
Aye.
Aye. Anybody opposed? Any abstentions out there? All right, onward and upward. So Madam Clerk, we can return to the agenda.
Moving back to the agenda, item 1 under new business, requesting commission approval of amendment 3 to a 5-year professional services contract with Southeastern Michigan Health Association.
Okay. Is somebody from administration presenting this to us today? How to work the mic? And we'll start with your name and title, and please go forward, ma'am.
Sure. Avni Sheth, Health Officer and Medical Director for the Public Health Division under HHVS. Commissioner Colleen, this is a request for approval of Amendment 3 to the agreement between Wayne County and Southeastern Michigan Health Association. Under this agreement, SEMHA provides staffing capacity and all the other relevant HR and administrative support for its employees who are placed in various HHVS county programs. This amendment number 3 specifically is being requested to support additional COVID-19 funding and temporary staffing required to continue our COVID-19 pandemic response activities, including epidemiology, case investigations, and vaccination efforts, in addition to a few existing programs that have experienced an increase in funding and staffing needs.
Hey, and I'm sorry, I kind of missed your name there.
Avni Sheth.
Ami?
Avni. Mhm.
So what is left of dollars and programs that we're running through the health department with regards to COVID? Just a overall picture?
So our current COVID-19 pandemic response activities and programs continue to be the epidemiology work, monitoring, surveillance, the case investigation work, and then also our emergency preparedness and vaccination efforts. So those are still continued programs that we're awarded to do in fiscal year 22 and 23.
People still getting the vaccine?
Yes.
And can any of this money, I mean, we have the, what is it, the YSR now? What's the other virus out there? It's hitting the kids pretty hard.
RSV.
RSV. Yeah.
Mhm.
Any of the COVID money being able to use for that?
This COVID-19 funding is restricted to certain COVID-19 related outbreak efforts. They do support some other, in addition to primarily focus on COVID-19, we can respond to certain urgent outbreak concerns in the community as well.
All right, I'll step back here. Commissioners with questions or comments, Commissioner Marecki.
Mr. Chair, I'm wondering how the medical marijuana and outreach and education program fits into the COVID relief.
Sure. So the majority of this amendment number 3 request to increase funding is going to about 94% to our COVID-19 programs. There are the medical marijuana and our 2 Healthy Families America program also experience an increase in funding that is going to be put towards enhancing that staffing model in this amendment as well. So these are programs that are part of the initial contract. However, we base that 5-year budget based on a projection over those 5 years. And we know that can change depending on what we're actually awarded year to year.
Okay, so this isn't the COVID, this is another funding.
The medical marijuana is a separate funding stream, and the Healthy Families America program is also a separate funding
Okay,
stream.
thank you.
Good, Commissioner. Questions, comments from commissioners? Are these general fund dollars or grant dollars
These are grant dollars
from?
from MDHHS, and the medical marijuana is through LARA. just separately. Mhm.
Okay, if there's no more questions or comments, I'll take a motion on item 1.
I'll move it for approval.
Moved by Commissioner Marecki, supported by Commissioner Dobb. All in favor of the motion, please say aye.
Aye.
Aye. Opposed? Any abstentions? Any at all? Okay. It's unanimous, Madam Clerk. What's next on the agenda?
Item 2, requesting commission approval of a 3-year subrecipient contract with 2 one-year options to renew with Arab American Chaldean Council.
Brady, anybody from administration want to talk to us about WIC? Yeah, you might as well just stay there. We're going to call you up probably at the next one too.
I should have
And
just
once
stayed up
again,
here.
we'll go through the name and title for record.
Yes. Avni Sheth, Health Officer and Medical Director for the Public Health Division under HHVS. So this is a request to approve a 3-year contract agreement between Wayne County and Arab American and Chaldean Council, and also the Arab Community Center for Economic and Social Services. They'll be providing, this is a subrecipient grant to provide WIC program services to high-risk, low-income women and children in Wayne County.
Okay, and so this is a new contract,
This is a new contract,
and they've been a previous provider of WIC services for us, correct?
correct?
If I'm not mistaken, they're one of the biggest providers we have.
There are, ACC and Access are two of our longstanding primary subrecipient WIC providers in Wayne County. This,
Are there going to be any other contracts this year? So you bid this out
yes,
and they won. Any other WIC contracts being bid out right now?
not subrecipient contracts, no.
Questions, comments from commissioners on this item? Commissioner Marecki and then Commissioner Dodd.
Thank you, Mr. Chair. And actually, I want, if I may, through the chair, go to finance. I have a question on page 1 of your fiscal agency report. The bolded, you're talking about the payments. And you may know this. How long have you been with the county?
Since February.
Yeah, not very long. So that's why I'm not asking you, because I think that about the payments, it's in bold, like maybe this is something new. About payment should be contingent upon receipt and approval by the county of a financial status report. Go ahead go ahead.
Sure.
'Cause I don't know if they know what
Can
I'm
you
talking about.
please tell me what you're looking at so I can?
It's our fiscal analysis.
Okay.
So that's why I didn't want to put you on the spot, but do you know about the payments?
I do understand the general model of the reimbursement system that we
Okay.
had with this contract.
Okay,
And they, submit monthly FSRs that we reimburse them for.
okay, is that something new? Does anyone know, or newer? I'm just wondering why this area is bolded. Like,
Does commission's fiscal staff weigh in on this, please?
maybe,
Through the chair, Commissioner.
Who are you? You got a job title?
Terrence Adams, Chief Fiscal Advisor, Wayne County Commission.
Oh, now I know you. Thank you, sir.
I'm sorry, Terrence, I didn't mean to put you on the spot with
Oh,
this.
no, it's okay. I believe we just wanted to point out that the payments are contingent upon receipt and approval of the county. So until the county approves the various payments, no payments, the organization will not receive funding. So just to make sure that it's point out that we have to approve every receipt that comes through.
Now, is that somewhat new? Is that?
Kamal Kaparu, Finance Director for the Department of Health, Human and Veteran Services. No, it's always been reimbursement.
Okay, okay. When I saw it bolded like that, I thought maybe this is a new. Okay, sounds good. Thank you.
And Mr. Caparu, if you may, I'm just going to follow up on that. If we get more people needing WIC services, we report that to the state of Michigan. in terms of our numbers for funding. And hasn't it been the habit of the state of Michigan that if we say we got 550 more people, that it kind of automatically gets funded by the state?
Correct. It's over, I don't know if it's over 3 years or 5 years, but right, well, if they see us trending up, then yeah, just what you said.
Yeah, and that doesn't need any particular approvals beyond the bureaucratic work.
Correct.
Commissioner Marecki, you still have the floor if you
No,
don't.
I'm good. Thanks.
Alrighty. Commissioner Dobb?
Thank you, Mr. Chair. My question was the same as Commissioner Markey's, but I'll just follow up. Do all of our other WIC providers operate with the same reimbursement process as this?
Yes, Commissioner.
Okay, thank you. Thank you, Mr. Chair.
And what are the trends for WIC? Right, we've been going through this public health crisis and all sorts of stuff. Sometimes that decreases people showing up for these, sometimes it increases. What's our general trend on WIC in the county and the number of families that need that?
So I would say that during the pandemic, the need for WIC services was actually more in need. And, you know, we also switched to a telehealth and remote model as well. So we could continue providing these services because they're critical and essential. And so we made a lot of implementation changes so we can continue to provide these benefits and these supports for our families in Outwayne County. And so I would say that, you know, the need has increased and requiring more intensive efforts to help families navigate and get to, you know, the formula shortage that happened. We were heavily involved in helping to navigate our families.
Do you have in round numbers how many families we're serving through WIC?
So I can provide that as a follow-up for the overall WIC program. I do have those numbers for ACC and Access in terms of, because they were prior recipients under our WIC program. I don't have handy the overall WIC program numbers, but I can provide that to you.
I would appreciate if you could. I think it's a good idea for people to vote on this money, to know the numbers and what the flows are. And it's also at least one snapshot of how things are going in the county in terms of the number of people that need these services. So if you could provide just an overall number, you know, I don't know if we necessarily need them by location, because we've got, how many locations can people go to for WIC services?
We have 8 locations that are in addition to the ACC and Access locations.
Yeah.
So
Yeah.
8 Wayne County operated sites.
Yeah. So if you could provide that, that would be great. Looking for a motion on item 2.
Approval.
Dobb supports. So the motion is properly on the floor. All in favor of the motion, please say aye. Aye. Opposed? Any abstentions? We are one unanimous group today. Madam Clerk, what do we have next?
For the record, Commissioner Anderson has requested an excuse.
All righty.
Item 3, requesting commission approval of a 3-year subrecipient contract with 2 one-year options to renew with Arab Community Center for Economic and Social Services.
Okay, anything additional from the department on this? Told you should have stayed up here. Now come to the mic if you're going to say something. We got to be on the record. I'd appreciate it.
Some reason thought they were both on the same agenda item. So this is the contract with, this is a 3-year WIC contract. Sorry, Avni Sheth, Health Officer and Medical Director for Public Health, HHVS Division. This is a 3-year contract agreement between Wayne County and Arab Community Center for Economic and Social Services to provide WIC program services to high-risk, low-income women and children in Outwayne County.
And Access has been, we've contracted with them for years on this.
Yes, they've been one of our longer-standing WIC recipients as well.
They made it through the RFP process, and here we are. Questions from commissioners on this item? None, I'll take a motion on this item. Becky supports. Motion is properly before us. All in favor of the motion, please say aye.
Aye.
Aye. Opposed? Any abstentions? Okay. Let's move the agenda, Madam Clerk.
Item 4, requesting commission approval of an intergovernmental service provider agreement with 2 one-year options to renew with Detroit Wayne Integrated Health Network.
Anybody from administration introducing this item? There we go. Oh, look at this. And I don't know if you planned on it, but this 5 million is kind of a contractual thing that we're obligated as a county to do every year. 5 million to the Mental Health Authority, if I'm not mistaken. But anyway, name and title, and what do we have here?
Good afternoon, Mr. Chair and Commissioners. My name is Khalif Morse. I'm the Deputy Division Director for Clinical Services with HHVS.
Good afternoon, Keith Dugokensky, HHVS, Correctional Health Administrator, Chair, Commissioner.
What's that acronym?
Pardon?
You used an acronym there.
Oh, with the Health Human Veteran Services.
Oh, okay. Yeah, HHV, okay. I just go HH. Yes, sir. Please tell us about this.
So this agreement is to reimburse the county for up to $5 million in mental health services provided in our jail divisions 1 and 2 for inmates for mental health services.
This is an annual 5 million that we do to support these services?
Annual up to 5 million, yes.
Up to, yeah, it's an up to.
Yes, sir.
Okay, and we've been doing that how long? Do you know?
Many years, 10 plus at least, Chair.
Yeah, I think this kind of arose once the authority became established. And there was some discussion about now it's no longer a county agency, what kind of support the county would provide for this. So yeah, it goes back to that time. Anything else, gentlemen?
Thank you.
Okay. Questions and comments from commissioners? Okay. I'll take a motion then.
I have a
Oh,
question.
Commissioner Marecki, I'm sorry.
No, that's all right. I just thought,
Yeah, late.
late
You
question.
caught me.
So is this enough money really for all the work you do in there in the jails?
So we always could use more money. But currently we are estimating our year to date about $4.7 million.
Okay.
And so we have been using the funds accordingly. Once we move to the new CJC and capacity is increased, it might be a discussion to have around that. But at the moment, we are available and using the money.
So you're thinking when you move to the new CJC, the capacity is increasing, but do you think the number of inmates are gonna increase the way it's been going?
Unsure, but we are watching the numbers monthly. And if it does, we will have to have a discussion about how to meet that need.
Thanks.
Does any of this money go to the juvenile detention facility?
No, it does not.
That's just the, yep. And have we ever gone over the 5 million and had to do more in all of these years? Anybody know? I can't recall that we did.
Again, Keith Dugokensky, Correctional Healthcare Administrator. The funding set aside by DWIN at times has been more than the 5 million. It's been 6, 7 in some previous years. I think the last 4 years or so have been pretty steady at the 5 million mark that you have before you here today.
Ready, thank you. Questions, comments from commissioners on this item? He has a
Move for
motion. I'd
approval.
love to hear it.
I'll move for approval.
Commissioner Dodd moves it. And support from Commissioner Marecki. Proper motion before us. All in favor of the motion on the floor, please say aye.
Aye.
Aye. Opposed? Abstentions? It's Unanimous. Thank you very much, gentlemen.
Thank you for your time.
Yep, thank you.
Madam Clerk?
F, such other matters as may be properly submitted before the committee.
I'm aware of none, so we'll move the agenda.
Public comments.
There any, well, let's start. Is there anybody with emails that have come in, Madam Clerk?
There are no emails.
There are none?
No.
Okay. Anybody on Zoom that would like to have comment to the Health and Human Services Committee? Anybody on Zoom? Buddy on Zoom, third and last time for public comment. All right, we'll move the agenda then, Madam Clerk.
Adjournment.
Move to adjourn?